Member for Surrey South.
In 2019, government received a strategic climate risk assessment that said, quote, over 100 excess mortalities could occur in BC and over 1,000 people could experience negative health impacts, end quote. But instead of acting on the warning, the Premier blamed those who died, saying, quote, it was apparent to anyone who walked outside that we were in an unprecedented heat wave. Again, there's a level of personal responsibility, end quote. Ignoring advice has consequences. It was government that was unprepared, with ambulance response times taking up to 16 hours and people dying, waiting for that help that never came. The Health Minister a minute ago said a number of things need to be done in response. The report was 2019. Government's had a couple of years to put things in place. So perhaps the Premier's cleanup crew would like to explain why the Premier blamed vulnerable seniors and people who couldn't afford air conditioning for their own deaths.
Minister of Health.
Thank you very much, Honourable Speaker. I simply, and I'll just say I disagree with the assertion of the Honourable Member, but what I'll say is this, that what you see in terms of vulnerability is the challenge of social isolation. Prior to the pandemic, the member will know, took unprecedented action for adult day programs for seniors, to increase home support for seniors, and in fact, people with home support were less vulnerable in this time, to increase respite care for families to support seniors in community and in care. These are unprecedented actions, actions that have been recommended by the Seniors Advocate and others for a long time, that action was taken in those areas. With respect to the BC Ambulance Service, a dramatic increase in the hundreds of new people hired and new ambulances put in place, including air ambulances to support our ambulance system. In terms of inequality, significant action for people with disabilities, significant action for income assistance, extraordinary action in the area of housing. And yet, and let's acknowledge this, on that weekend, we lost people. We lost too many people. And my responsibility as Minister of Health, and all of our responsibilities, is to work with everyone we can to ensure that we are prepared for what is coming, because this 1 in a 1,000-year event will no longer be a 1 in a 1,000-year event. It has happened, and we have to take action accordingly.
Member on supplemental.
Thank you, Mr. Speaker. The Minister's right. There were too many deaths. But the Premier blamed people for their own deaths. First responders in British Columbia thought the Premier's comments were out of line. Take the words of the President of the BC Professional Firefighters Association, quote, it's sickening to hear those comments. We have a large percentage of our population that don't have access to proper cooling in buildings that they live in, end quote. Again, the Premier needs to explain why he chose to blame the victims of this tragic heat wave for their own deaths.
Minister of Health.
Thank you, Honourable Speaker, and thanks to the member for her question. The Premier, myself, every member of the government, I believe every member of the opposition understands now, if understanding was needed, and I think it's fair to say all of the actions taken on the issue of climate change demonstrate that commitment that has been there for years for people in this legislature, the need to take even more action to be more resilient. This was an unprecedented event. We had an event, the member refers to the report, we had an event in 2009. At that time, 110 excess deaths as a result of a heat event that was mostly centered in the Fraser Health Authority at that time. But it took, I would say, till 2018 for the heat warning system that applies everywhere else in the country to be applied by the federal government to British Columbia. These events are the result of climate change, and action is needed to respond to them. Since 2017, the Premier has shown his commitment by addressing inequality, by addressing climate change, by supporting people where they need help. I think he is committed, as every member of this House is committed, to supporting people and to responding to the impact of this unprecedented heat wave. We are going to receive soon, I believe, sometime in the future, the report of the coroner, which will be a case-by-case analysis of what happened. That is the independent review is required. The BC CDC and the Provincial Health Office is doing its own review. You saw the preliminary findings at the UBCM, which were shared with the opposition, and it's our intention to continue to become more resilient as a society, but also continuing our efforts to deal with inequality, continue our efforts to deal with social isolation, and continue our efforts to fight climate change.